Your hands are complex and wonderfully designed machines. Together with your wrists, they help you do a remarkable variety of tasks, from playing the piano to cooking dinner or hammering a nail. Your hands respond daily to various commands that ask for feats of strength and dexterity. To put it simply, your hands are literally extensions of your brain. More of your brain is reserved for controlling hand movements than for controlling any other part of your body. Clearly, your hands and wrists are important to every aspect of your life. You use your hands all day, every day, both at home and at work. Yet, in doing all of these things that they do every day, your hands and wrists are prone to accidents and injury. This program is designed to show you what you can do to prevent injury and what to do just in case an accident occurs. Now, before we go any further, it's important to take a quick look at the structure of your hand and wrist. This will help you to understand the types of injuries we'll discuss later. Let's begin with the bones. Bones form the structural support and strength in your hand and wrist. Altogether, there are 27 different bones in your hand and wrist. In comparison, there are only 3 bones in your arm. The bones are surrounded and tied together by muscles, ligaments, and tendons. Ligaments are strong, fibrous bands of tissue that serve to stabilize joints and prevent damage by limiting side movements of joints. Tendons permit flexibility. When a muscle contracts, the tendons lift or curl the fingers. All of these, working together, enable your hand to perform some remarkable things, including grasping and the ability to pick up small objects with your thumb and index finger. Now, let's take a look at the different kinds of hand and wrist injuries. Remember the information we've just discussed about bones, ligaments, and tendons. Wrist fractures. This injury is most often caused by trying to break a fall with an outstretched hand. Sometimes the ends of the forearm bones can be broken too. Hand and finger fractures. Generally, this is caused by trapping or twisting the fingers suddenly. Fingers caught in a car door, for example. Accidentally hitting the fingers, such as with a hammer, can cause a finger fracture. Hand sprains. These occur when the ligaments in the hand or wrist are stretched too far and tear. Thumb sprains, for example, are a common sports injury. Fingertip injuries. Fingertips are subject to many different types of injuries. The bones can be fractured, the fleshy part of the finger may be torn, or the fingernail may be damaged. Lacerations. Lacerations, or cuts, can be minor, that is, only affecting the layers of skin, or major, serious, deep cuts which sever nerves, muscles, or tendons. Lacerations can occur if you're not careful while handling sharp cutting tools, such as knives or saws. Nerve compression. This injury results from a swelling of tissues that surround a nerve. As a result, there's a loss of feeling, or sometimes a tingling. Repetitive movements are the culprit here, as they tend to create the swelling of tissues. Caring for hand and wrist injuries depends upon the type of injury. A hand surgeon or emergency physician can treat the problem. Emergencies, such as lacerations, will be cleaned and sutured, while x-rays will be taken first for fractures to properly diagnose the problem. Your doctor may ask you questions about how the accident or injury happened. If the injury is believed to be a sprain or fracture, the fingers, hand, or forearm will be examined and gently moved to determine the limits of movement. This helps to diagnose the injury correctly. Fractures of the fingers, wrist, or forearm are treated by being repositioned or set to their former position before the broken bone is immobilized with a cast or splint. Pins may be used if the fracture is in an unstable area. A cast is generally used here, and the cast will probably be removed in 6 to 8 weeks. Sprains are treated in a different manner. Usually, anti-inflammatory medication is prescribed to reduce swelling, and the area is immobilized with a splint or cast until the ligament heals properly. Other specific hand and wrist injuries require very specific treatments. For example, hitting your fingernail with a hard, direct blow, such as from a hammer, can cause bleeding beneath the fingernail. This condition is called black nail. Sometimes this will disappear as the nail grows out, but if pain or pressure continue, your doctor will relieve this by drilling a hole in the nail to drain off the blood. A crushing blow to a fingertip, such as a finger being caught in a moving machine, can fracture the last bone of the finger and drive the fingernail upwards. This avulsion of the nail is treated with a thorough cleansing, and fragments of the bone are removed. Damaged portions of the nail are removed as well. A tissue loss, as from a pinching or tearing injury, is usually repaired with either suturing or surgery. Skin will be sutured back together, or in very complex injuries, surgery will carefully repair tendons and ligaments. Sometimes skin grafting will be necessary to restore function and appearance. A splint may be used to protect the finger as it heals. Lacerations or cuts are treated according to their depth. Minor injuries, like those from a sharp knife, are usually fairly shallow because the force of the cutting instrument is not very great. This type of cut is cleaned and can be closed with either a butterfly bandage or a few stitches. Major lacerations usually cut skin, tendons, and nerves. This type of deep cut usually occurs from an accident involving machinery or power tools. Surgery is necessary to repair damaged tissues, and the skin is stitched closed. Splints are used to immobilize all major lacerations while they heal. Physical therapy may be necessary to restore full use of the tendons and help loosen scar tissue. Nerve compression. Now, this is often called carpal tunnel syndrome. Pain and numbness of the hand and fingers is generally caused by swollen tissues pressing on the median nerve, which runs through the carpal tunnel in the wrist. This injury is a bit different than the previous ones, as it's caused by repeated flexing of the hand and very repetitive motions. It's an acquired injury, not the result of a sudden accident. Treatment involves medications to relieve pain and swelling, followed by splinting to keep the wrist straight. Severe cases are treated with surgery, where the carpal ligament is cut to relieve the pressure on the nerve. And there are other proven treatments besides surgery to correct carpal tunnel syndrome. Because you use your hands all day, every day, there's always the chance that you may injure them. However, you can decrease the chance of injury even further by working safely and carefully, both at work and at home. While at work, be extra careful around machinery and power tools. Use caution while handling knives or other sharp objects. You can prevent a hazardous fall by watching where you're walking and avoiding tripping hazards. Watch out for potential hazards. Don't take chances around broken glass or sharp pieces of metal. Think about keeping your hands and wrists safe, on the job and at home. Just think about all the wonderful things your hands and wrists do for you every day. Isn't it time you took a little time to care for them? Thank you.